Sierra County is 900 square miles of sparsely populated terrain. To the east, we have ranching communities. To the west, we have small mountain towns. There are no hospitals in Sierra County or emergency rooms.
In eastern Sierra County, first response is provided by Fire District emergency medical volunteers until the ambulance arrives. Paramedic staffed ambulance services are provided through Eastern Plumas Healthcare. In western Sierra County, first response is provided by Downeyville and Sierra City volunteer fire departments. A paramedic staffed ambulance is provided by Downeyville Fire Protection District. It is financed by public donations through Sierra Frontier Medical Resources, Incorporated. There is currently no public funding for emergency medical services in Sierra County. Because of the lack of public funding, responsibility for EMS defaulted to the fire departments. They get no additional funding for emergency medical services. Measures E, G, and H are a proposed public funding system in which visitors and residents will share the costs. A slight increase to the transient occupancy tax coupled with a small parcel tax will raise about $100,000 for emergency medical services in Sierra County. Measure E, the TOT increase, will raise about $26,000 for Sierra County Fire District Number 1. That district is comprised of Calpine, Sierraville, and Satley. It will also raise $33,500 for Sierra City and $19,500 for Downeyville Goodyear's Bar area. About 50% of the ambulance calls are for visitors. Measure E is a way for them to share the cost. The 2.5% TOT increase will go for emergency medical services in the district where it was generated. Resort, hotel, and inn owners don't pay the tax. Rather, it is added to their guests' bills. Campgrounds are managed by the United States Forest Service, so they are exempt. Short-term renters of vacation homes like Airbnb and VRBO, however, must pay the tax. Measure E will be voted on county-wide, even in areas that will not be directly affected by it. There is no cost of living increase associated with the measure. It is not tied to any other measure, so it may pass on its own. Loyalton doesn't participate in the TOT since it is an incorporated city. It does, however, vote on the measure since it is a county-wide measure. Measures G and H, the parcel tax proposals, only apply to western Sierra County. Measures G and H are designed to raise $46,000 a year for EMS in western Sierra County. The fee will be $60 a year per improved parcel. That's just $5 a month. It doesn't apply to unimproved parcels, and it sunsets in 4 years, so it will return to the voters in 2024. There has been an increase in the number of medical runs recently. In the first 2 quarters of 2020, we've almost equaled the number for all of 2019. There is definitely a need for advanced life support in Western Sierra County. Western Sierra Medical Clinic in Downeyville has limited hours and offers no emergency services. Life-threatening medical problems need immediate response, and the nearest emergency care is at least an hour away. Sierra County doesn't have the financial resources necessary to provide emergency medical services, but it does provide $20,000 a year to Western Sierra Ambulance Replacement Fund. Ambulances function for about 10 years and cost about $200,000. In Eastern Sierra County, paramedic-staffed ambulances are paid for by the Eastern Plumas Healthcare District and Sierra Valley Hospital District through a tax. Paramedics are trained and authorized to provide advanced life support beyond services that can be provided by an EMT. These include such things as cardiac events, respiratory emergencies, and advanced airway management. EMS volunteers care for you until more advanced help arrives. The Downeyville Fire Protection District Ambulance, which also serves Sierra City and Goodyear's Bar, makes about 100 to 150 medical runs a year, but the numbers are rising. 80% of these require advanced medical intervention. Of the resident patients, half are from Sierra City and half are from Downeyville and Goodyear's Bar. 33% of these cases require helicopter evacuation. These are for such things as trauma due to accident or injury, cardiac management, respiratory issues, and stroke management.
We ask your support for measures E, G, and H. Watch for details in the Mountain Messenger, the Sierra Booster, and the Sierra County Prospect. And check out our Facebook page, Sierra County, California Emergency Medical Services. And most important, cast your ballot and make sure it is postmarked by November 3rd. And please support EMS so they will be there when every second counts.